Hello and welcome to the Acute Respiratory Infection Virtual Ward at Warrington and Holton Teaching Hospitals NHS Foundation Trust. A virtual ward provides hospital-level care and remote monitoring in your own home, allowing you to receive care at home where you are most comfortable. You will be cared for by the Rapid Response Respiratory Team from the Trust and Merseycare NHS Trust, who provide the monitoring equipment whilst you're on the virtual ward. You will have a discussion with a clinician before being admitted to the virtual ward to make sure it is right for you. Don't worry, you'll be shown how to use the monitoring equipment and how to submit your observations each day, which will then be followed up by a phone call if there are any concerns regarding your results. Contact numbers will also be provided, which will allow you to contact us with any concerns. Every day we have a virtual ward round where we discuss each patient's needs and progress. At any time, if there's any concerns regarding your care, we can speak to one of the respiratory consultants. The virtual ward is a very supported system which allows you to have your care at home. How are you feeling?
Not so good.
Not so good.
Felt better.
This is your second time on the virtual ward, isn't it?
Yes, it is.
So how did you feel when we first suggested it to you?
Apprehensive, really. I'm not very technology conscious.
Right.
Wasn't sure that I'd be able to operate it, but it was so simple.
And did the nurses, when they came out, explain it all to you?
Yes, they did.
Yeah.
And I found it easy to use.
Right, that's good. And then do you feel reassured that when you put your observations into the portal every day, do you feel reassured that they're looking at those observations?
Yes, I do.
Yeah. And then they ring you, don't they?
Yes, most times it's followed up by a phone call.
When you first went onto the virtual ward, was there any specific reason why you wanted to be on it? I know we offer patients a choice whether they want to be on the virtual ward or not.
Well, I was determined not to go into... I was much worse the first time.
Yeah, you were.
And I would have had to have gone into hospital.
Right, so it saved an admission?
Yes. But my husband was having treatment for prostate cancer.
Oh dear.
And he was going to Clatterbridge every day for radiotherapy.
Right.
So there was no way that I would have gone into hospital.
And left him?
Because I would not have left him.
No. So that was a real prevention of admission, wasn't it?
Absolutely.
One, because you didn't need, but you didn't want to go in either.
Yes.
Yeah. And then this time, you've only been on it a few days again, haven't you? We put you back on it. Because when you phoned the other day, I asked if you wanted to go back on.
Yes.
And I think you jumped at the choice.
Definitely.
Yeah.
The other big advantage of it is, if you're admitted to hospital, and I have been many times, the biggest problem is that you pick up other bugs when you're in there.
Absolutely, yeah.
And that you also, in your own home, you're more relaxed, you get more rest,
yeah,
and you can eat and drink what you want when you want, which is a big advantage, because when you're ill, you don't often feel like eating when it's their lunchtime, or things like that. So the advantage of it from a patient is tremendous.
Yeah, because you can have little and often of whatever you fancy.
Yes.
Which isn't always the same in
and
hospital,
numerous cups of tea.
Yeah, home tea.
We got a lot of support when I was on it last time, because my husband and I were both ill.
Yeah.
We got a lot of support from our family. So the family were able to come in and out whenever they wanted to. They were bringing us meals. Neighbours were helping too. The other thing, I found you're not tied to visiting times. It would have been a drag for him to try and get to hospital.
Absolutely, yeah.
There are no disadvantages.
That's brilliant.
To being on it.
Yeah. And you felt well supported?
Yes, I did. I knew that I could either ring yourselves, or I could also ring Merseycare.
Absolutely, yeah.
So you had support from any time in the day, really.
Yeah, absolutely.
At the picking up a telephone, and that doesn't happen normally, and it wouldn't happen in normal circumstances if you were ill at home. I think it's better and it's more comfortable, and you're more relaxed than you are in hospital. Plus the fact I can go in my garden. You can look out at the flowers and the things like that, and you can watch the birds flying around.
Yeah.
And it's just so much more relaxing. I think as well, you just being able to see out and look at the view, that relaxes you as well. So where are the disadvantages? But I did find the system so easy to use.